Hi, everybody, and welcome to today's presentation. I'm Maiya Hogan, and I just want to say welcome to the second in our monthly webinars for Transplant Life. Today, we're going to be talking about medication and symptom tracking. If you attended our first webinar, you might know the format. So we're going to do about 15 minutes of education, followed by another 15 minutes of Q&A. So I hope you guys came with your questions. Today, we're going to be hearing from Dominika Woch. She is one of the community managers for Transplant Life and KidneyLyfe. She's also a kidney transplant recipient and a former dialysis technician. I'm going to go ahead and turn over the time. Thank you, Dominika, for being here today.
Thank you so much, Maya. Hi, everybody. Welcome. I am going to really quickly share my screen. So, as Maya said, my name is Dominika. I am a kidney transplant recipient and also the KidneyLyfe and TransplantLyfe community manager. Um, I got interested in working with our community and working with patients and advocacy because when I was diagnosed in pediatric care, I had everything was set up for me. I was taken care of by a nephrology team where everybody kind of did the thinking for me. And as I got older and I transitioned from pediatric to adult care, and then from one transplant center to another, I've come across many different care partners, many different people taking care of me and providers. And so, you know, being freshly post-transplant and having to go to college and juggle not only the schoolwork, but moving away from home, moving away from my mom, who was my care partner, and then having a brand new team that I'm not very familiar with, it required being organized. And back then, I wasn't quite as organized as I am now, but I have, in my time, realized that there is a huge benefit in being organized and tracking your symptoms, your medications, and the little things that happen in between your visits. I also worked as a hemodialysis technician, which, you know, some people who have now received a kidney and who have been through dialysis know those are very long days and very long hours. And so um, when you have your day off and you're trying to figure out your doctor's appointments, scheduling, not just medical appointments, but then anything else you may have going on, taking care of your family, it gets difficult and we're all human and it's next to impossible to have to remember everything. So I personally have benefited from adjusting to a system where I can now keep track of everything and I don't have to remember it all. So our objectives for today are to understand the value of structured medication and symptom tracking, know how to use an app like TransplantLyfe 365 to track your medication symptoms and how to create reports, and to feel empowered to discuss struggles, initiate conversations about medications, symptoms, and medication changes with your providers. So many of us know that doctors are very limited on time, right? We're in and out of a doctor visit within 5 minutes. Now, when we're starting off in our transplant journey, that process looks a little different. It's very long. There's a large team of people that you meet. You have people from the transplant team involved. You have maybe your primary care provider involved. Um, the doctor who's leading your care. For me, was a community nephrologist, right? And then on top of that, we're being sent to all these different providers who are going to evaluate whether we are ready to undergo a surgery like that, right? And in that evaluation process, you not only have to keep track of your visits, but you have to be able to talk about what you come back with from all these other visits, right? You have to be able to track metrics. Sometimes it's losing weight, right? Sometimes it's keeping track of your blood pressure. And so there's just a lot of moving parts. But in this time, we get a little bit more time with the providers, right? You have this big meeting with your team. There's more time committed to you in that period of time. And especially after you receive your transplant, right? We're seen by our team several times a week. You have to go get labs done, and everybody's checking in with everything. And as you start to space out, you get less and less time with your provider. So you go into a visit and the provider has about 10, maybe 15 minutes to see you, right? We oftentimes go over the labs and then we're expected to kind of move on. And you get the question, do you have any questions for me? And most of the time when I would get that question, my mind goes blank. I go, nope, I don't think so. I'm good. I'm all set. And I'm already thinking about where I have to go next. Am I going back to work? Do I have to pick somebody up? I'm never present in the moment. So having something that can keep you on track where everything is listed out for you is beneficial. You have an agenda for those 10 minutes to start the conversation with your doctor, to follow up on your labs, to follow up on whatever questions you might have, and to make sure that everything you're looking to talk about in that visit is right there and is being talked about. When we consider all of the things that happen to us in transplant and why is it so important to keep track and speak up, it is that we as patients have a tendency to minimize what's going on with us, right? We are almost too grateful to complain about things that are not directly threatening our life or threatening our transplanted organ. Um, and it makes sense why we end up like this because a lot of us are coming from very, very difficult paths, right? A lot of us were in the ICU, on dialysis, too sick to eat, you know, constantly fatigued, unable to think. It's difficult, right? And so when we finally have this new functioning organ and we start to feel better, it's very hard to focus on, you know, the small things, right? You're not going to be thinking about tremors, right? You're not going to necessarily be thinking about headaches because we are so happy that things are getting better, right? Um, but generally speaking, we have heard from many patients that even the patients who have a great team, right, when they start to speak up, sometimes they're not exactly heard, maybe they're misunderstood. And, why is that, right? I think that happens because doctors are so focused, especially in that first year, on how well our transplant is doing, right? Everything is measured by the success of that graft and not our quality of life. That's not to say that doctors don't care, but we are responsible for shifting their focus, right? The other thing is that we are receiving so much information in a difficult time that, we're not worried about what's going to be happening to us, a few months from now, a year from now, a couple of years from now, right? We're focused on the then and now and just getting out of the hospital, going home and staying home, right? And slowly getting back to our everyday life. The other big component is that education immediately after transplant is mainly focused on the immunosuppressive side effect of our drugs, right? And that's not to say that we're not told that, you might have tremors, you might have brain fog and all these other things. It's that it is so crucial. And there's so much emphasis placed on the fact that we have to be careful because we're immunocompromised, not to catch an infection that can potentially harm us even further. So, with everything going on, what is it? What is it that we can do? Well, there's a few things that are within our control, and that is to track and speak up, right? If we have a detailed list of what goes on in our day-to-day life, it gives us a visualization of what goes on throughout our life and during various visits, in between visits, and it gives us the potential to visualize the correlation. There is a record of occurrence and reoccurrence over time that is really hard by doctors to dismiss, right? And there is the fact that we're not expected to remember everything. We are human, and you know, I can have something going on with me, and I'll say, "Oh, I'll make sure to let the doctor know that I'll write it down. And I'll write it down somewhere, and I'm gonna forget about it." And then when I am asked that question of, "Do you have any questions for me? Do you have any concerns?" I won't remember that, and I'll leave that appointment. And the next time, I have a stomach ache that, reminds me that, hey, I've been having these stomach aches, and I should have mentioned that. I'm already done with that visit. So having something that's, right there, it's able to show all of your symptoms. It's able to show that you have taken your medications and, perhaps there is a correlation, perhaps there's not. It's essentially an agenda for your visit, and it lets you stay on track to get the most out of those short appointments. So I personally use the TransplantLyfe 365 app, and I know that there are many different ways to track. Some people use diaries, notebooks, maybe the Notes app in your iPhone, right? Um, Maybe you write down your all of everything on one piece of paper the night before, and you go to your doctor visits, and all of that is great. And I think every single one of us should do what works for us. And I would recommend that if you do use a notebook, make sure you write the time, what medications you have taken, and write down as much detail as possible. You want to remember what else was going on, maybe what you ate that day. A lot of times things get dismissed, right? Doctors say, oh, well, maybe you have a headache because you haven't eaten that day yet, right? And so it's good to have as much information as possible so that, you know, months from now you could recall with as much detail. So I'm going to take a few moments to walk through how easy tracking is and just to show you what the app looks like and what you could do with it. So as soon as you open your TransplantLyfe 365 app, you get this nice little welcome screen, right? Good afternoon, Dom, and everything. And you have this nice little bar on the bottom that's showing you symptoms, health, which is all of your health metrics, medications, and resources. If you are adding a brand new medication, it's pretty simple. You just click the add button and you start typing, and you have all of these options that come up that you could just select easily. It even gives you the strength and format, right? So are you taking in a capsule? Is it powder? Is it a liquid? Hopefully it's not a liquid. And if you can't find the specific medication, you could just, enter it manually. And then you're able to set how frequently you take the medications and what time you take the medication so that you get a nice little reminder that pops up for you to remind you to take those medications. You could also nickname the medications, right? You don't have to remember the full name as long as you know what medication you're referencing. You could give yourself directions. Are you taking it without food? Are you taking it with food? Are you taking it with water, with orange juice, whatever it is? You're able to customize that and you're able to input notes. And I would recommend, especially at the beginning of your care, right after that transplant surgery where we are very likely to go through dosage changes, medication changes. Keep those notes right there so you know exactly what changes you went through and why. But your day-to-day medication tracking can be very simple. I am a very hectic, very ADHD person, and I cannot spend too much time doing something. So for me, this is easy. I go in, click on medications, click take, and what happens is the medications closest to that time of the day will be highlighted, and you could just click confirm. I have a medication box, and I have a feeling that many of you guys do as well. And I can't tell you how many times I have run out of the house and not taken that medication box with me and just forgot to take my medication. So it has been nice to have a reminder that kind of comes up a little bit before my medications are due. And when my medications are due to remind me that, hey, you better take these at 9:30. Um, so, it also happens that I miss and I forget that uh, I need to check off that I took my medications, and that's okay because you have the ability to go back in and say, hey, I know I took the medication. It's not in my pill box. So I'm going to check it off. And you know what? It's a system that keeps you in check in two different ways, right? 200% accountability, as they like to say in hospitals. And this is another way, if you forget how to log, you could easily go into this history button. You could select the medications that you missed. And by the way, when you click this, it will show you the current day, but you're also able to filter through medications. So if you know you just forgot to take one, or you could filter by day and you could look at yesterday, last 7 days, or you could enter specific dates. Now, for symptom tracking, I go back one slide. you could see there's this plus button right here. So if I click that plus button, this is the screen that I get. And here you could input your blood pressure, your heart rate, your temperature, symptoms, weight, blood sugar, fluid intake. Fluid intake, that's an important one for a lot of us. Anxiety, happiness, or you could create just a regular note. So if you click on symptoms, you have a nice little pre-filled selection of symptoms. And these are, the very common symptoms that a lot of us might experience post-transplant. So if you're experiencing something that is not on this list, you are able to input it in right here. I am a migraine sufferer, and having to keep track of my migraines was one of the most difficult things for me. I don't really know why, but um, this app made it easy for even when I do get a migraine and I can't stand to look at a screen, I'm able to just really quickly go in, select that, and walk away. And then later on, I always like to go back in and input as many notes as possible so that when a doctor or PA or APR and whoever asks me, I'm able to record with as much detail. And this is the little summary window that you see. You could have an itemized list, or you could look at it as a graph, which I think is great because, if a doctor says, well, let's see how you do by the time we have our next appointment. Let's see how many headaches you have. But you could say, well, hey, in the last month or in the last 3 months, I've had 7 headaches, right? Or whatever the symptom is. That's a great visualization. No one's going to deny you having headaches or that they're affecting your life when you could show them how frequently they are happening. And I had a friend, Cramy, tell me a great story where post-transplant, she was suffering from headaches and they were happening at the same time of the day. So when she went to go see her team, they said, well, maybe it's because your blood pressure is dropping. So what did she do? She tracked her blood pressure for a weekend. She said, nope, my blood pressures are fine. And then they were able to find the solution by kind of tracking and eliminating all the things that could be causing that headache. I think the best part about this is that you're able to take every little thing that you track and create a report. So if you click this little notebook button on the top and you click report, you will get a sheet of all the reports you've created. You could filter them by date. You'll have your latest report up here, and then you could hit create a report. And this is what that will look like. You will be asked to put in a title, select the dates that you want to look at, and then you could select everything that you want included on there. And then you'll have a nice little report with details of what's included. And you could preview it, you could print it, or you could just keep it on your phone and, use it right off of your phone during your visit. And this is what one of those reports looks like. So any questions you might have on top will be displayed right there. I don't really track my weight, but I know many patients do, and it's, an important thing that is talked about. So you'll have a nice little graph of your weights. And then after that, you'll have your symptoms, and they will go by date, what the symptom is, how frequently it happened, and any notes you've included with it. Right after that, you'll have your medications, the strength, the quantity, how frequently you take it, and a nice little compliance score. Don't judge me on my compliance score, okay? I'm better at taking my medications than I'm showing you today. And this is just a great thing to be able to then take out during your doctor visit. And really, who is better at leading a conversation than you, than us, than the patient, right? The doctors, sure, like I said before, they'll have things to go over. They will ask for what questions you might have, but they are limited on time. And so having a tracking system that we are able to control and we're able to hold both ourselves and the doctor accountable. We're going to be better self-advocates if we're, keeping the data and saying, hey, this is bothering me. And we had another great conversation with our founder, Dr. Karin, where she said, we have to shift the focus from saying, we're not complaining because we are so grateful that we received this organ. Talking about what's happening to us, talking about what's affecting our transplant, what's affecting our day-to-day life is taking the best care of our organ that we possibly can. It's, it's caring, it's wanting to preserve our longevity. And so we as patients really have to shift the focus from looking at bringing up even the little symptoms as complaining and showing up to these appointments and saying, hey, I have these list of things that are happening. This is what I would like to talk about. These are the questions I have. And let's talk about what we can do to make sure that I am doing everything I can to keep myself healthy. And, an added bonus is that, again, we are not superheroes. We're pretty superhuman for all that we have to juggle, right? But it shouldn't be on us to remember everything all the time. And so let the app, let your tracking system, whatever it is, let it remember it for you. All you have to do is write it down, put in as many notes as you possibly can so that you can recall it later on and let your system do the remembering for you. So thank you guys very much. And I would love to continue the discussion with what works for you, any questions you might have. So please.
Yeah. So, Dom, I'm looking through the chat and there's been just a lot of really great comments of people sharing their experience. And it brings up one of the questions sort of on theme is what else do you think is worth keeping track of? So we focused a lot on medications and symptoms today, but you know, what else can you keep track of? Like, are there lab values? You might have mentioned blood pressure. And what do you see value in keeping track of? Like, where do you put your time and energy when you're tracking?
Yeah, absolutely. I mean, I just took a sip of my water, but I like to keep track of my fluids, right? I know if I don't drink a certain amount of water, I'm gonna have a headache, right? And my doctors know that too. They know me, they know my flaws, right? And so I like to show, hey, on this day, I recorded that I drank this much. I think blood pressure is a great thing to keep track of. You don't have to necessarily do it every day. I know it can be tedious, but a lot of us post-transplant, our medications, they have an effect on our blood pressure, right? Even our day-to-day life, the stress of it. So it's a good thing to keep an eye on. And as soon as you see things trending up, you're able to bring it up, right? You shouldn't wait till you have a visit and they're like, well, your blood pressure is looking a little high, but let's wait till your next visit in 6 months or a year to then talk about it again. I think, there isn't anything in the app that links directly to your lab values, but that doesn't mean that you can't leave a note. And so if there's something that's making you worried, right? Let's say for me, I would be tracking creatinine. And so if let's say my creatinine is trending up, right? So creatinine trending up could mean your kidney function is going on. Doesn't have to mean that, but it could. And so for me, I have done that before where I kind of have the number in mind and then I will track in between the next time I get labs and see if me drinking my water has had an effect on it, right? Has me taking my medications on time had an effect on it? Prior to utilizing this system, I used to kind of take my medication. I would wake up, I would take it, right? I would go to bed, I would take it. And, I could be waking up at 6 a.m. or I could be waking up at 8 a.m. and I could be going to bed at 9 p.m. or I could be going to bed at midnight. And so I wasn't very consistent with it. But when I started to get these reminders, I took it more seriously that I should really take these as close to that 12-hour mark as possible, right? And so I'm able to kind of see whether there is a correlation between my creatinine and those things. There might not be, right?
Mhm.
But it does give you a better picture for what's going on.
Well, that's so interesting. Just to comment is that one, it's helping you from a behavior standpoint be consistent with your medications, independent of your conversations with your physician. But also, then when you go to the doctor, you can say, no, I am being consistent. I am doing this, and these are the changes I'm seeing or not seeing, or these are the effects I'm seeing. Someone asked, what are your doctors most interested in hearing about when you're bringing this stuff to their attention? Like, what kind of data are they most interested in?
So I would say one thing I have noticed, doctors weren't expecting me to talk about my tremors getting in the way and brain fog, right? And so when I say it, it's always like expected that like, oh, okay, you're a little tired, you take better care of yourself. But very recently, I have started pushing this idea that I do have brain fog, and I think it's starting to remind me of the time when I was on dialysis, right? It's not great, and so let's evaluate. And I think my doctor did. Um, Seemed surprised and was really kind of delighted by the fact that I took I took the time to actually track this and look into this and study this. And, there are many things that can cause us to have headaches, many things that could cause us to have stomach issues. And it's hard for the physicians to, evaluate all of those things right then in that moment, right? They might be able to ask you some questions and eliminate some options right then and there. But for the most part, it's on you to then go back and bring them more information. So I think um, it's something that they appreciate, and it makes their job easier that they know that, hey, even though your blood pressure is elevated here, maybe it's just because I'm making you nervous, because when you're going home, your blood pressures have been fine and we don't have to make an adjustment, right? Nobody wants to take more medications than we already take, or higher doses, right? For example, of blood pressure medications. So I have found that there's appreciation for tracking blood pressure and all these things that they would have to ask us to go back and bring them more information on.
Okay. And I've seen a lot of people say that, like their experience tracking their symptoms unrelated to the transplant, having dates, having notes, having severity information, and keeping track of that really did help resolve some of the issues they were experiencing over time. And one of the things I picked up on in that is that your team sounded happy that you were bringing them this information. Do you think people get at all concerned that by bringing up side effects with their care team that they have a good relationship, that this might alienate the relationship or somehow offend the team that you're bringing these side effects to their awareness?
Yeah, so I have to say that it almost doesn't make sense, but I've had a similar feeling. Like I don't want to be, you know, making them feel like they're not doing a good job, or are almost sounding accusatory. And it's really not that. I think that they they appreciate us taking as much charge of our care as possible, right? And they're better able to advise. And I think a great way to say, to kind of bring this up is like, hey, I started using this app to give me a better idea of my overall well-being, and to make sure that I don't forget to ask you questions. And just to have a better productive appointment. I think I've sat through appointments where there isn't really anything going on, and it's just kind of like, okay, so everything's good, but like you don't want to end this appointment within 5 minutes, so you just kind of sit there. And so I think that doctors do appreciate it, right? And it's that's generally what shows them that a patient's going to do well, because they're going to have things under control. They're going to speak up if something's happening, and there's a possibility to intervene sooner, right? And so I don't ever think anyone should ever feel that way, that your doctor is going to think um, you know, you don't value them, or you think they're not doing a good job. But I understand, because I've been there myself. And I think that it also gives you an idea, right, of who you're working with. And if you're bringing all of this to the table and you're saying, hey, I'm struggling with this, but you're continuously not getting a straight answer, right? Then maybe it's time to go ask for a second opinion, right? Or ask to maybe speak to a social worker, somebody who can kind of step in and maybe rephrase the question, right? So it gives you an idea of where to go from there, because you're doing everything you should on your part.
Yeah. So another question is, can the app track medication quantities remaining? So maybe that's helpful for remembering when to refill meds or something like that. Is it able to keep track of that countdown, sort of?
That's a great question. So the app will show you how many doses you have taken in your day. And that's a question, that's a great question, actually. And I will look into that. And that's definitely something that I could follow up on and maybe post once we post our webinar to the website. But I would also encourage everyone to reach out to me. My email is dominika@lifebulb.com. And I would love to have, either a conversation of what you do that works for you, or, just talk about what has worked for me that might help other patients. But also, if I could ever walk anyone through the app or answer more questions, I'm more than happy to do that. I truly believe in this app. I think it can make things better for us. It can make us better advocates. And so, I'm more than happy to do that. And I will look into that and try to post an answer when we do post this recording.
Awesome. Thank you, Dom. All right, so we have hit our time. As Dominika mentioned, you can continue to reach out with her with any questions. just to help navigate the app and support your own tracking. That was a phenomenal webinar. And thank you, Dom, for taking the time to be here with us and to put this all together. As she mentioned, there's going to be a recording of this webinar available at transplantlyfe.com. And hopefully, then we can also address some of these additional questions that come through. There is a survey as well that will be going out to everyone who attended today's presentation. And there's an opportunity to leave your questions there, along with any feedback you have about our webinars and any requests for future content or topics for our education. Our next webinar is going to be on March 17th at 5:30 p.m. Eastern. Next month, we're going to have a wonderful guest social worker who's going to be talking about how we have those productive conversations with our social workers on our team and how we can really utilize them as sort of champions and to empower our progress in our own care. So I'm hopeful you're able to join us. As always, if you'd like to keep up with our webinars and you can't attend the live session, they will be posted again on transplantlyfe.com under the webinar section. So if you missed our presentation on healthy goal setting last month, that's already up and live for you to check out. And we're going to go ahead and end it here. I really appreciate you guys joining us, and we hope to see you next month.
Thank you guys so much for having me.